My name is Robert. I'm a doctoral intern here on the Child and Adolescent Inpatient Unit at Rogers Behavioral Health in Oconomowoc. In my own process of applying for internship, I was looking for an environment that would push me in a lot of different directions and also give me a lot of autonomy and decision-making wherever I was. And Rogers has allowed me to do that. It's a fast-paced environment that offers a lot of quality training and a lot of opportunities for growth in many different directions.
My name is Mia Taberson, and I am a doctoral intern that has been here at Rogers Behavioral Health in the Inpatient Child Adolescent Unit. The Child Adolescent Inpatient Unit is located at the Oconomowoc campus, and as an intern, this is a really beautiful setting for us to have our office. As you're walking outside of the main buildings, there's really incredible gardens, especially in the nice summer months of Wisconsin. You can spend time outside and take advantage of the really lovely facility and amenities that are here.
A day in the life of an intern, it can look like many different things. We typically begin our day, by checking some emails and maybe doing some patient chart review. And then we have a staffing pretty early in the morning where we have an opportunity to virtually sit with the whole team and hear about the patients that are on the unit and kind of get a status of their treatment. After that, it could go a few different ways. We might help with admissions. Oftentimes, we'll be assigned to check in with a patient on a more individualized basis if they need any help on the unit behaviorally or doing treatment planning or diagnostic work.
Every day is a little bit different. Once a week we run groups. So I'm working with the children and running a lot of DBT groups and working on different skills. But for the younger kids, we do a lot of games, a lot of interactive experiences. For the older adolescents, they're going through a little bit more individual work and thinking about goals and skills that they want to be using. But the groups is a really great way for us as interns to interact with a larger group of patients here on the unit.
Hello, come on in. There you go.
As interns, we get a lot of supervision. There is the somewhat typical individualized supervision where we can meet with the supervisor. I have two supervisors on the Child and Adolescent Inpatient Unit. One that I work with kind of directly about cases on the unit, and another that I speak more broadly about in terms of the internship and kind of my path into early stages of my career as a psychologist. Also throughout the day, the supervisor is regularly available for informal supervision, to collaborate on cases or ask any questions.
While interning here in the Child Adolescent Unit, we have the unique opportunity to provide supervision for individuals who are working with the patients on a daily basis. So they're called PCAs, and they help take patients to and from groups. They're interacting with them at mealtime. They also are the ones that patients come to a lot with, maybe if they're having a really great day or if they're having a really tough time. And that can be really stressful for PCAs. So myself and the other intern, we provide a group supervision for the PCAs, and we're interacting with them to help, discuss challenging situations in the milieu, also helping to build their professional skills and just generally providing support as their role working one-on-one and in a group format with the patients.
Yes, thoughts? So one of the things that attracted me towards being an intern at Rogers Behavioral Health is all the different types of opportunities that are available to us in terms of training in the field of psychology. That could include program development within the community. Currently, I'm working on program development for a community support system within the city of Milwaukee. There's also opportunities to be involved in research as an intern and also to participate at a collegiate level with the staff at Rogers Behavioral Health on several different committees.
One of the unique things about being at a larger organization like Rogers is that as interns, we have the ability to engage in a variety of different professional development activities. One of the unique things that I'm working on right now is collaborating with my other fellow intern on developing training materials for a local organization here in the community. So it's a really great way to take our clinical skills outside of just the immediate patient care and expand our knowledge, challenging our professional skills. How do we work? How do we collaborate with other professionals? And how do we share this information with our community?
There's a lot of collaboration with the staff here. It's a very integrated feel and makes you feel like part of the team at a professional level. And that's something that I appreciate as an intern in training, emerging into an early career that's unique as an intern at Rogers.
What I have really enjoyed in this internship is just the relationships that I formed, both with my fellow intern here that is at CAU and then with my supervisors. That's something I maybe wasn't expecting, that would be one of my highlights, but just the support and collaboration amongst the supervisors and my fellow intern, and just that dynamic that these are long-term relationships that will be continued in this more consultative role and professional role after, but that has really been one of the best parts for me.